So we are going to have a small session on radiology of abdomen. We have covered these radiology sessions in different parts of the anatomy classes, like radiology of upper limb, lower limb, thorax, etc. So in abdomen, we are going to cover two sessions or two sections of radiological anatomy. One is plain X-ray that we have commonly seen, like a normal X-ray having this particular gray shade, white shade, and the black shades. Now in abdomen, we frequently use a dyes, and that particular dye visualize some of the organs which is present within this particular abdominal cavity, and we can understand the functions of that particular abdominal cavity organ, and we can understand these particular diseases related to it using this particular spatial technique. We call them as spatial X-rays. So these two domains we will be discussing here in abdomen. So we begin with this particular plain X-ray, then we move to the spatial X-ray of the abdomen, and we'll conclude after that. So it's going to take like 20-30 minutes to explore these things. So beginning with the plain X-ray. So whenever you are given with the X-ray plate, there's a way of reading the X-ray which will rise in the following things, like what are the types of X-ray that we have to figure it out, if it is a plain X-ray or it is a spatial X-ray. That means you are going to see something special which is normally not visualized in this plain X-ray. That makes this particular X-ray special one, and if it is not, that makes this particular X-rays just like a normal X-ray. Now after that we go for the views, like how this particular X-ray is coming, anterior to posterior, it is penetrating the organ or penetrating the part, or if it is coming from sideways directions, we call them as lateral X-ray and anterior-posterior X-ray or posterior-anterior X-ray, depending on how this particular X-ray is coming. We call them as view of the X-ray. Next is what you are seeing into this particular plates whenever you are observing. That means the region you have to describe. If it is upper limb, you have to precise which part of the upper limb, like arm, hand, finger, etc., etc., that you have to understand. So region of that particular X-ray plate, that you have to describe. And then we have this particular bone, we have to present within this particular X-ray region, what are the bones you are seeing. If that bone is partly present or fully present. If that particular bone is making any kind of joints, that means articulation or not. What type of articulation is there, that you have to see. Then you have to move for this particular soft tissue. If you have this particular soft tissue, that means other than bones, we have these tissues like muscles, we have the visibility of these particular ligaments, if it is there, if it is present on it, or we can generalizely term as soft tissue structures. So whenever you are reading this, you are going to do this particular like a narration of the X-ray plates. This is like a thing we already have done, starting from the views, starting from these types of the X-ray and region and the bony tissues. So with this same formula, we have learned this abdomen, we have learned this upper extremity, lower extremity, thorax, etc., etc. So this is also relevant for abdomen. So whenever you are given a picture like this with a plate on it, we have to do the same series of decoding of this X-ray like this. So whenever they are given, you have to understand what kind of X-ray it is. If it is a plain X-ray or a spatial X-ray, that means it is anything beyond that gray shade, black shade, and a brown and the white shade. If it is anything beyond, is visible or not. If not, it is a plain X-ray. If it is a plain X-ray, then you go for the view. That means how the lights or how the X-ray is penetrating that particular organ, anterior to posterior or posterior to anterior. That thing, that view of it. Then you go for the view, then you go for the region. What region you are seeing at, in abdomen or thorax or etc., etc. In case of the abdomen, we are seeing it, and a part of this lower thorax as well visible, which is a part of this particular hip bone as well as visible. So part of this extremity is also visible in that particular region. Then what in that region you are seeing, like bony shadows, like bones, what you are seeing here, like if you are seeing some bones, what are the names of that particular bones? midline bones like vertebra, side bones like ribs, and if you can see it like a upper part of the ribs or lower part of the legs, whole of a rib or part of a rib. Then go for the lower bones like a part of the hip bone visible, right side, left side, which part is visible, which part is not. Likewise, you have to do. Once you're done with this particular X-ray of this particular region, then you go for soft tissue shadows. That means anything beyond this particular ivory shadows, then you go for soft tissues. That means the gray shadows over there. That means you have a placement of the liver likely there, kidneys present on there, but they are not visible. So they are known as soft tissue shadows. Muscle, you cannot figure out. Like coils of intestines, they are not figured out, cannot be over there. So you cannot see anything special in it. That makes this particular X-ray as a plain X-ray of abdomen, anterior posterior view, and showing this particular region, abdomen, and showing these particular bones like this, and showing these particular shadows of this along with the soft tissue shadows. Along with the soft tissue shadows, you see some areas which is blackened over here. So this blackened area is representing some kind of presence of some air entrapment, where air can be there in abdomen, that you have to see. Like in this particular stomach, in that region, if you see it, it may be stomach fundus region. If you see this particular region having air shadows like in the black like this, you may have this particular small intestine which is holding this air like this. So this is all about the X-ray that's commonly given. We call them as plain X-ray. Going from this particular plain X-ray, what you can yield or what information can you get from it? You can get this particular bony shadow diseased or not. If something is broken in the crowns of bone, you can figure it out. If something is calcified, if something is present as a stone, that you can figure out. If you have a kidney stone, that can be picked up in this particular X-rays if it is calcified one. You have gallstone that is calcified, can be picked up in this particular region, which normally doesn't pick up. So these are the things that you're going to understand in this particular X-ray. We call them as plain X-ray. Now moving from the plain X-ray, you are going to see something special. We add something and see something. We call them a special X-ray. One kind of special X-ray, we call them as barium X-ray. We call them as barium X-ray. On the barium X-ray, we use the barium sulfate as a dye. That particular barium X-ray, if it is taken and taken through the mills, that means we ask the patient to swallow it, eat it, and take series of pictures depending on what organ you are seeing. So we call them as Barium Meal X-ray. We give barium salt to the patient to consume like 500 ml. For example, you give that particular drink to drink, and the patient after drinking, you take the picture. What you get in that particular time, after that region, you take a picture, you can see this particular barium is present or passing through the stomach. So while it is passing through the stomach, if you take this particular X-ray that time, you can visualize the interior of the stomach, like parts of the stomach, fundus, body, pylorus, and jejunum, ileum, like that. So you can see this particular interior of the stomach, which normally can be seen. That makes it a special one using this particular special dye, which is known as barium sulfate. And that particular barium sulfate illuminates the interior of this lumens, and you can see this particular region. You can see the rugaes. You find these craters. If it is ulcerated, you can find craters inside to it and analyze accordingly. So this kind of mill or this kind of thing, we can say that it is a barium mill. We can identify the shape of this particular stomach, which normally looks like a J letter. So that particular J letter stomach can be seen in this particular barium mill. Now, if you want to explore further, you want to see this duodenum, you want to see the small intestine, we can call them as barium follow-through. We wait for some time and then again take a picture till the barium salt passes through the duodenum, ileum likewise, and take a picture. You get an idea of the small intestine. Then we call them as barium meal follow-through. So then we can visualize beyond the stomach as well. So we can see these coils of small intestine, which is present as a folds and intricate detail of the interior of the small intestine. We call them as the barium meal follow-through. That means the barium meal which was there in the stomach followed through the intestine, the barium meal follow-through visualization of interior of small intestine. Again, the special X-ray. Now, within the special X-ray, can you see these other things like bony shadows, soft tissue shadows? Of course. So you are seeing this particular same thing, like the region and the same description thing that remains the same. That means What kind of X-ray it is? It is a special X-ray. Now, what kind of view it is? Anteroposterior, posterior, anterior. What region you are seeing? That's the same thing we are seeing, like the abdominal region. What in the abdominal region you are seeing here? A bony shadow, like you are seeing this particular bony shadow, and as well as soft tissue shadow. What special thing we are seeing here? Here comes with the special thing. Out here is barium meal. Coming to the barium follow-through, likewise, the same thing. Abdominal organs which can be visualized like stomach and this particular interior of the small intestine along with this particular bony shadows like this. So, it also gives two results into and split into two different regions. So, this serves to purpose for us, gives a prima attention area of this interior of the organ along with the general shadows as well. Now, this is what we call them as barium meal, barium follow-through. Now, if you are using the dye instead of consuming through our rectum, we call them as barium enema. So, we give the dye, the same barium salt through anus, and then we wait for some time or push it hard through the pipes and see and visualize from retrograde direction, from this particular rectum, sigmoid colon, descending colon, transverse and descending colon up to cecum. So, this particular area we call them as barium enema. So, same barium salt but given through a different route to visualize the lower part of the abdomen properly or lower part of these abdominal cubes properly or quickly for these particular barium enema special slides. So, these are the kind of special slides, one variety of it besides this particular general X-ray of the abdomen that you have to go for. Next thing, if you are going to visualize the kidney system like kidney, urinary bladder and this particular ureter, then also we are going to use something special. Again, we are going to use this particular element as dyes. In case of visualization of the kidney, we have to use or administer the dye through the veins. We call them as intravenous administrations of the drug. And that part administrating the drug, you are seeing kidney system. We call them as IVP, in short, intravenous pyelography. That means you are going to see this particular kidney system, that kidney, ureter, urinary bladder. So, this is how you are going to do, throw the dye through injections into the vein, wait for some time, take the picture on that particular region. What picture? Of course, X-ray you are going to see. And this particular thing is visualizing the thing which is coming with this kidney with the calyceal system. How does that work? Goes to the vein, filtrated through this particular filtration process of this kidney through the Bowman's capsule, capillaries and etc., excreted out, then it enters to this calyces, minor calyce, major calyce, pelvis, ureter and drops into urinary bladder and whole picture can be captured. So, how this particular urine excretory system is working, we can figure it out. And while it working, if you have any stone impacted into these pathways, we can also figure it out. So, this thing we call them as excretory urogram or descending pyelogram, where you are seeing these excretory functions of this kidney, you can figure out this pyrolar system. That means minor calyce, major calyce, then we have the renal sinus, then sinus, this renal pelvis, then you have the ureter. This is narrow tube which is narrowing down, if going down to ureter, right side, left side. Now, the ureter as it is going down, sometimes visible, sometimes not. Why it is like so? The ureter is constantly producing this particular urine going through this part, going through this constriction and relaxation. We call them as peristalsis. So, when this particular peristalsis contractions is there, the dye is not visible at that point because that is in contraction mode, where other part of this thing which is dilated, that is showing. So, this part is not visible, this part is visible, then it is not visible, again it is visible. It is not an error of the ureter system, it is because the peristalsis is going on. When this part is contracting, the dyes cannot be seen because the lumen is closed and it is pushing this particular urine down. Then that part which is relaxed is receiving the urine is visible. So, this is how this thing is coming over here. So, this major calyce, minor calyce, pelvis, urinary pelvis, ureter is visible like this. And then you can see this particular abdominal like pelvic organ present in the central part, circular one which is present where the urine is stored. So, after this, after some time, say for example 20 to 30 minutes, this particular picture is taken, clears the whole system of this calyceal system as well as storage system, urinary bladder, can be captured in the same picture. So you give the dye like 2 o'clock, take an X-ray at 2:30, at 2:30, around that particular time, you get the whole picture visible along with the urinary bladder. And analyze that, zoom it, see that if any filling defect is there or not, or any stone is there creating some kind of filling defects or not. So this is how we are going to see the kidney system. We call them as intravenous pyelogram. The same dye we are pushing that, but this time your dye you are pushing here through IV route, intravenous route. Iodine containing dye usually normally used for this particular intravenous pyelogram. Compared to the other one, we use the barium salt. Now, this particular intravenous drug, if you are putting here, you have to make sure the patient is not allergic to it. That means if the patient is allergic to it, you push the drug, it creates allergic reaction, the patient can be in shock. So before pushing the drug, you have to make sure the kidney is working fine and the patient is not allergic to it by giving some small dose to test this allergy test and then use this particular process. This is how the whole thing can be used. Other ways, you can visualize this particular thing in a reverse way. Likewise, in the first time we see this particular enema thing, this can be seen in a reverse way. We see this particular retrograde pyelogram. That means through the urethra, you are going to the urinary bladder and then to the ureter and to the minor calyx, major calyx like way. So we call them as retrograde pyelogram or also known as ascending pyelogram. So we put the drug through this particular urethra, going to the urinary bladder, then to this particular calyceal system. So it is kind of like a ascending pyelogram. Before it was descending pyelogram. That means the dye was dropping from above. This time the dye is going from below and visualizing the same, giving the same result. So again, what kind of X-ray it is? General X-ray or is a plain X-ray or special X-ray? Special X-ray. What you are seeing here, view region remains the same, and what special thing you are seeing here, that's what you have to narrate out here. So whenever you are seeing this particular thing, first thing is only difference is that it is a special X-ray using special procedure. The dye is being used to visualize something was not visible in the plain X-ray. So this is how this whole renal system can be visualized. Likewise, if you are going to expose the female reproductive system tract, we call them as salpingogram, and you are exposing the uterus, we call them as hysterosalpingogram. That means you are exposing the uterus, the fallopian tube and the patency of that particular drug. That means the vagina, the cervix, the parts of the uterus, the fallopian tube, and it is spilling over. You are going to see that. How we are going to do that? You are going to put some kind of drugs which is going to be pushed through. So this, you are going to push this drug through the cannula, through this particular way, through the tract, we call them a cervix. You push the drug or inject the drug and wait for some time. Then you take the picture, likewise you have taken it. As the drug is going through an ascending curve through this uterus, that means parts of the uterus can be visible. This is the cannula, this is the vaginal tract. We are going through the cervix. Reaching to the cervix, you throw the drug, and then this particular cervix is transmitting this particular dye, going from cervix to this through the cervical canal, going through this particular uterus, the cavity or body of the uterus, then you going to this particular parts of uterus and going to the fallopian tube, and then it is going out of this fallopian tube into the pelvic cavity. So it is coming out of this particular opening of the fallopian tube. The fallopian tube have got two opening. One is to this uterine side, other is on the abdominal or abdominal pelvic side. What is the function of the fallopian tube? It's to collect and catch the fertilized ovum, which has been fertilized by this particular sperm and the ovary meeting over here in this region. So this particular fertilization is taking place in this particular fallopian tube. It receives the ovum and receives the sperm. Fertilization takes place in the ampulla, and then this particular ovum goes over there. So we basically exploring the whole tract of the female reproductive system. So you're seeing this particular uterus or interior of the uterus, you're seeing this particular the fallopian tube, the parts of it, and everything is taken in the same picture using this drug, which is given through this particular like a vagina or this part cervix and seen through. So we call them as hysterosalpingogram. Then again, What is this particular plate? It's a plain X-ray or special X-ray? It is a special X-ray. What region you are seeing and what view you are seeing? Anteroposterior view, what region? This particular region, pelvic region is showing here. What's general thing you are seeing here? That means bony shadow, soft tissue shadows. You are seeing here any bony shadow, that particular bony shadow is presenting in any formation of joints or not. If it is, fine. Soft tissue, if there any visible, no, yes, fine. Then anything special you are seeing? Yes, you are seeing this special, you are seeing this particular reproductive tract. Which part of the reproductive tract you are seeing? You narrate it and we are done. So this is all about this particular system visualizing with the special dyes into this particular region. Similar to it, we can visualize the other thing related to the gallbladder, third one. The gallbladder and this particular mechanism of this mechanical functions of the gallbladder. We call them as cystocholangiogram. That means we are going to see the gallbladder system and the functional thing of the gallbladder. That means the liver is secreting the bile and it is stored in the gallbladder. So this particular mechanism, and then it is thrown out through this common bile duct to this particular second part of the duodenum. If that whole network is working fine or not, we are going to explore it out. So again, we are going to give some kind of meal which is containing this particular dye. Then that particular dye is again taken a picture through this particular diagram and going to see the gallbladder. If this gallbladder is filling correctly or not, that we have to see. Inside this gallbladder, if you have filling defect or not, that means this particular gallbladder, you see the margin looks like pear-shaped organ. Now the cavity of the gallbladder is this one. Now inside the cavity you see any black shadows, that means it is known as filling defect. How this particular filling defect can appear? It can have a tumor, commonly it can have stones. So if you have a filling defect in the gallbladder, we say that there is a filling defect inside the gallbladder. That means you need to explore how this particular interior or gallbladder is not visualized properly. That means you have to investigate more to exclude out if it is a tumor or if it is a stone. Likewise. So this is again what kind of picture we are seeing here, we are going to see. The third variety or a most advanced variety that we have to see the interior, we call them as endoscopic retrograde cholangiopancreagram. That means it's a visualization of the thing with the camera. So this particular thing that we are going to do here is that we put a tube along with the camera into it and some kind of visualization light which is placed inside. So we ask the patient or anesthetize the patient if it is required to, through endoscope, through mouth, we put this particular tube kind of thing with a light source. We put the light source to this particular second part of the duodenum. In the second part of the duodenum, we have a major duodenal papilla. In that major duodenal papilla, we have an opening of this particular element, which is known as the opening of the common bile duct and pancreatic duct. Now, on that opening, we are probing through, go inside. Once you go inside, we can get this particular common bile duct and as well as common or main pancreatic duct. We go into this particular common bile duct and climb up into this hepatic duct or gallbladder. So, in a way, we are going through endoscopes and going through the retrograde way, that means through the export or through that particular tube, we are going retrogradically to visualize the gallbladder and pancreatic network. So this particular thing is a picture, we can take it. We can see this particular stone if it is there and take a picture of that. So we can see the picture which is present in it and take a narration of that. So we can see any kind of narrowing, we call them a stricture. If you see any stones or anything visible, any mass which is present in it, we can see it clearly. So this is a direct visualization through the endoscope cameras and light source is being used. So this is advanced variety of this particular endoscopes. There are many forms of endoscopies is there. So it is one kind of endoscopies. There we call them as first phase endoscopy, then second phase endoscopy, third phase endoscopy likewise. So this is one of the endoscopic procedure which is done reversely. That's why we call them as reverse or retrograde endoscopic cholangiopancreagram. That means you are going to see this particular gallbladder network or bile duct system as well as pancreatic duct or pancreatic systems. This thing can be visualized. So this is how we have done. We call them as duodenum can be visualized on the same process that as you are going through the same endoscope. So in ERCP of these endoscopies. Now ultrasounds can be used for these as well. So endoscopic ultrasounds can be also done in this particular same process. If you are going to see this interior of this particular organs which is related to the pancreas, which is deeply placed, retroperitoneal, we can do that endoscopic ultrasonography of the abdomen as well. So this is the imaging process or imaging thing that is commonly been performed in abdomen, starting from the straight X-ray to the special X-ray. Special X-ray are of different regions, we name it differently: Barium Meal, Barium Enema, etc., IVP, intravenous Pyelogram, cholangiogram, Hysterosalpingogram. So you have to get used to the terms and what exactly you are doing and what exactly you are seeing, and that's it. No diseases or no complicated factors you have to analyze out here. So this is all about this particular abdomen X-rays. That's all for this session.